Good morning. Thank you for meeting with me. I want to talk about the health literacy issue that we have in our offices, but more importantly, among our elderly patients, because our elderly patients do have needs that our other patients do not. They are very independent people, but they also have a more difficult time remembering instruction, and they have a difficult time understanding what needs to be done. They do spend a very short amount of time in our office just to be assessed. Most of their care is done at home with their medication or their wound care. So if they don't understand the instruction and they don't understand what they're supposed to do or what it means, they will not be getting the care that they need at home because they would be treating themselves. So I do have a few proposals. The first one is creating sort of like a brochure. It'll be basically like a cheat sheet for our patients. They can put it to the fridge and it'll look something like this. And it'll have different sections for like medical terminology and medication help and for their diagnosis. But it'll also have office locations. So that way it's easy for them, to make appointments if they need to. And I do believe that this should be updated every month. It is roughly about $17 per 300 glossy sheets, not including the ink. So I believe it should be updated and have, the most current information every month. So that way the patient can continue to learn and be educated. And that way in the future, they will have better means of taking care of themselves. I do also believe that we should make all of our handouts, we should have a copy of them in another language because about 57 million Americans don't speak English. And about 5 million of those are over the age of 65. So the most common language is Spanish. About 57% of the elderly speak Spanish who don't speak English. So I do believe that we should have every handout and every brochure in our office done in Spanish. That way it's easy for them to understand because it's hard enough for them, people who speak English, to understand English. So I feel that that is important. And this study was done by the American Community Survey in 2010. So this number could have, increased significantly since then. Um, in addition to creating these brochures and in other languages, I believe we should have longer appointment times for the patients. Patients normally get about 15 minutes in the office. That's not including not just the doctor. That's including the whole visit. So that's triage and vitals and everything that they need to do. They only get about 2 to 3 minutes with the actual physician. According to a study done by the Wisconsin Research Network in 2002, when patients go in for a visit, they have roughly 3.7 problems they need addressed. It's very difficult to go into detail and to get the most information you can in just a short period of time. So the longer the time the patient has with the doctor, the more in-depth they can go into each of these problems so the patient can understand more, and that way they can care for themselves better at home. I do also believe that we should have monthly workshops in our office. Each month could be a different topic, and that way patients can come in and they can learn a little bit, about different diseases or different topics, or just different topics so they can further their education. We can educate them deeper than just the problems that they have at home. Because I believe that the more we can educate our patients, the better they'll be able to take care of themselves. And that's extremely important. And this goes along with all the class standards as well, because it's giving them access to, um, access to education, and it's helping people who don't speak English do better for themselves. And Sir William Osler, who was one of the founding professors of Johns Hopkins Hospital, stated, "Good physician treats the disease, but a great physician treats the patient with the disease." And I feel like if we treat the patient, we can prevent further disease and help prolong their life.